Poor people in America who don't have health insurance generally don't see the doctor unless they're in an emergency situation. And by then, for a lot of them, it's too late. I don't completely blame the healthcare situation for my mother's death, but I think it did play a role. My mom got used to not going to see the doctor. And a few years back, she had a severe respiratory illness, and I was genuinely concerned about her. And my brothers were concerned about her. My father was concerned about her. We all begged her to go see a doctor, even though she had recently become insured under the government health insurance for elderly in America called Medicare. She, for a long time, she refused to go see the doctor. Hello, this is Adam from American Teacher on YouTube. If you haven't, please click subscribe, give me a thumbs up, and leave comments in the comment section below. Today's topic is one that's close to my heart because I'm American, and the state of American healthcare has bothered me for a long time. So I saw this article today. It's from Associated Press, written by Mike Staub, dated July 21st, 2021. And it says, U.S. life expectancy fell by a year and a half in 2020, the largest one-year decline since World War II, public health officials said Wednesday. The decrease for both Black Americans and Hispanic Americans was even worse, 3 years. The drop spelled out by the Centers for Disease Control and Prevention is due mainly to the COVID-19 pandemic, which health officials said is responsible for close to 74% of the overall life expectancy decline. More than 3.3 million Americans died last year, far more than any other year in U.S. history, with COVID-19 accounting for about 11% of those deaths. Black life expectancy has not fallen so much in 1 year since the mid-1930s, during the Great Depression. Health officials have not tracked Hispanic life expectancy for nearly as long, but the 2020 decline was the largest recorded one-year drop. The abrupt fall is, quote, basically catastrophic, end quote, said Mark Hayward, a University of Texas sociology professor who studies changes in U.S. mortality. Killers other than COVID-19 played a role. Drug overdoses pushed life expectancy down, particularly for whites. And rising homicides were a small but significant reason for the decline for Black Americans, said Elizabeth Arias, the report's lead author. Other problems affected Black and Hispanic people, including a lack of access to quality health care, more crowded living conditions, and a greater share of the population in lower paying jobs that required them to keep working when the pandemic was at its worst, experts said. Life expectancy is an estimate of the average number of years a baby born in a given year might expect to live. So for decades, the U.S. life expectancy was on the upswing or increasing, but that trend stalled in 2015 for several years before hitting 78 years, 10 months in 2019. Last year, the CDC said the average life expectancy dropped to about 77 years and 4 months. By comparison, in Taiwan, the average life expectancy is 80.7 years, which is actually an increase from the year before. So you might ask yourself, well, why are Taiwanese people living longer? Is it because they are eating more healthy foods? Are they taking better care of their bodies? I would argue that the reason why I enjoy a 3-year increase in average life expectancy just by living in Taiwan is largely due to a national health insurance system, which is a single-payer healthcare system. So, looking at the statistics, how many Taiwanese have medical insurance? About 99.6% of Taiwanese people are covered under the National Health Insurance Program, which is a single-payer program, and it is extremely affordable, as I've mentioned before. By comparison, how many Americans have health insurance? Only about 55.4%. And this doesn't include the people who have extremely high premiums or high deductibles. People who have high deductibles or people who are underinsured. Their policies don't cover certain things, which I had to explain this to my Taiwanese students because they didn't understand the idea of a deductible. In Taiwan, if you go to see a doctor, there's no deductible to worry about. So I would argue that the cost, even though America has some of the best doctors and hospitals and healthcare facilities in the world, there is a great divide in access to health care in the U.S., and that is due to the cost of health care. A lot of people just cannot afford the cost of health care. And to tell a story from my own life, when I was 12 years old, I spent several years of my life without any health insurance at all when I lived in America. And when I was about 12 years old, my father had just switched jobs, and I was not covered by health insurance. I had the worst case of flu I've ever had in my life. I was so sick, I was so weak that I could not stand up. My father had to carry me to the bathroom. That's how sick I was, and I never saw the doctor because we couldn't afford to. We had just moved to a new city. My father didn't have health insurance yet, and so I toughed it out. Luckily, I survived. But for poor people in America, that's basically what they have to do. And they wait until they have severe health care problems before they go to see a doctor. And at that point, the cost of treating them is much, much higher than it would have been if they had started seeing the doctor preventatively, like getting a regular checkup. So poor people in America who don't have health insurance generally don't see the doctor unless they're in an emergency situation. And by then, for a lot of them, it's too late. I don't completely blame the healthcare situation for my mother's death, but I think it did play a role. My mom got used to not going to see the doctor. And a few years back, she had a severe respiratory illness, and I was genuinely concerned about her. And my brothers were concerned about her. My father was concerned about her. We all begged her to go see a doctor, even though she had recently become insured under the government health insurance for elderly in America called Medicare. She, for a long time, she refused to go see the doctor, and she struggled with this respiratory illness for a long time. She finally went to see the doctor and recovered. That was in January. I saw her in January 2019, and I'd made plans to come back in January 2020. Of course, this was before COVID-19. And in November, mid-November, early November, I got a call from my brother one night. My mom had a heart attack suddenly, and she was in a coma in the hospital on life support. And several things crossed my mind. My parents lived in a rural area at the time. And in my hometown, the hospital closed several years ago. So my hometown has no hospital. In fact, it doesn't even have a dedicated ambulance. It shares an ambulance with another area. And the ambulance generally tries to stay somewhere between those two areas. So I'm not blaming the EMTs at all. I know they did their best. I heard from my dad and everyone how much they tried to save my mom. They got to the scene as fast as they could. I think it took them maybe about 15 minutes. I'm just guesstimating there. But as you know, in a heart attack, every second counts. And I can't help but think what if my town had its own dedicated ambulance? What if my town still had a hospital? Would she still be alive today? So my mother, they revived my mother, and she was in a coma for a few days, long enough for me to make it home from Taiwan and say goodbye to her. And the neurologist, she had her heart attack on an early Wednesday morning, and we had a conference with her neurologist that following Sunday. And he told us what we had been dreading for a long time, and that was that she had suffered significant brain damage. And my mother had discussed with us what to do in that eventuality. She'd gone over it many times, and she had told us that she did not want to be kept alive on life support. So we respected her wishes and had her removed from life support, and she passed away that Sunday afternoon. But I can't help but wonder, if America had a single-payer healthcare system, would my mom have been more likely to have preventative healthcare? If she had known that having a regular health checkup was covered and she didn't have to pay a cent throughout her life, would she have gotten into that habit of going and having a regular health checkup? The doctors said that she had a weakened heart for probably many years before she had her heart attack. She just didn't know about it, and she didn't have symptoms that we knew of. So this is really personal when I talk about healthcare in the U.S. It's a shame. People in Taiwan, they have health checkups. They go to see the doctor when they're sick. They don't think twice about it because it's affordable. And the healthcare system functions well. The doctors are and the nurses are extremely competent. As I've said before, America is one of the very few developed countries that doesn't have a national health insurance scheme or plan. I shouldn't use the word scheme. Scheme has a negative meaning in America, and in the UK it just means like a government program. Another problem with the U.S. healthcare system, not to mention that people, if they have a heart attack and they do recover, and they don't have health insurance, they have to worry about how to pay for it, or if they have cancer, for example, they worry how to pay for it. And we know that stress is a factor in the development of these diseases. But in America, people have to worry about these things. Also, in small towns like my hometown, which once had a few thousand factory jobs and now has almost none, factories will, this is an inconvenient truth, factories will not locate in a town that does not have a hospital. There are a lot of liability issues. I mean, if you're working around heavy machinery, there's always the possibility, or dangerous machinery, there's always the possibility of an accident. And I can imagine workers' comp insurance would be much higher or prohibitive for a factory that located in a town that did not have a hospital. So I know a lot of people in my hometown wonder, well, why can't we get, factory jobs anymore? That's one of the reasons. As I was explaining the U.S. healthcare system in one of my English classes, one of my students happened to tell me that he owned a factory in Taiwan, and he told me it would be impossible for me to locate a factory in a town or city that did not have a hospital. He said I would never even consider it. So it perpetuates the cycle of poverty in these places. Not only do these people have less access to good paying jobs, they have less access to adequate health care. And it frustrates me that these same people will continually vote for politicians that are against affordable health care for all U.S. citizens. I just don't get it. I really don't. I mean, what could be worse than the system we have now? What could be more unjust, unfair than the system we have now in America? Where if you are moderately rich or wealthy, you have access to some of the best healthcare in the world. But if you are lower middle class or poor, or if you work in a job that doesn't provide health insurance, as many people do, you only see the doctor when you are in an emergency situation. I just don't get it. I don't get how people could be against a single-payer healthcare system or an affordable healthcare system for all Americans. So that's my topic for today. The shamefully low life expectancy in the U.S., the inequality in access to adequate health care in the U.S., which I believe has led to this lower life expectancy. And also, I think it has actually led people to become more cynical about healthcare and doctors in general in the U.S. And that could be feeding into why so many people in the rural U.S. don't trust the COVID vaccine, and they don't trust healthcare professionals when they plead with people to get the COVID vaccine. So if you have any comments, please leave them in the comment box below. Thank you for watching American Teacher. Bye-bye.
Okay.